Hi everyone, today we're breaking down the nursing process and how it applies to pharmacology. Nursing process consists of 5 overlapping phases, and each phase depends on the accuracy of the other phases. And the phases are assessing, diagnosing, or conclusion. This is a new term that you might see in some textbooks. Now we call diagnosis conclusion. Planning, implementing, and evaluating. The first step is assessment. Before giving any medication, the nurse must gather all the relevant data, and this includes patient history, allergies, current medications, comorbidities. For example, a patient with asthma should be monitored carefully before giving a non-selective beta blocker because this kind of medication will bronchoconstrict. Another thing we gather is vital signs, of course. Is their blood pressure safe before giving beta blocker? What is their heart rate before giving digoxin? All of these things need to be assessed before you give medication because you can cause harm. Lab values is another thing we assess. Are potassium levels okay before giving furosemide? Because furosemide is such a medication that will deplete their potassium levels. Is the INR in range before administering warfarin? Another thing to assess is patients' understanding of their meds. Do they know what they're taking? Do they know why they're taking it and what side effects to watch for? Pharmacology isn't just about the drug. It's about the patient's whole picture. Let's look at a real-world example. Imagine you have a patient prescribed digoxin for heart failure. Before giving it, you don't just scan and pass it along. You assess. First of all, you assess vital signs, and specifically for this medication, you need to assess their heart rate. Is their heart rate above 60 beats per minute? If it's lower, you may need to hold the medication and notify the provider. You assess their lab values. Why do we assess that? Well, because low potassium increases the risk of digoxin toxicity. That's why we would need to assess their potassium levels. You also assess subjective data. What do they tell you? That's something you cannot measure. The patient tells you they feel nauseated and see halos around lights. These are classic early signs of toxicity. So only by pulling all of this information together, you can safely decide whether to give, hold, or clarify the medication. That's why assessment is the foundation. Without it, every step after it on shaky ground. The second step in nursing process is nursing diagnosis. And again, you might see in some texts it is called nursing conclusions. Here's where we identify problems related to medications. For example, knowledge deficit related to new antihypertensive prescription. That's a nursing diagnosis. Or another one, risk for injury related to anticoagulant therapy. Remember, the focus here is always on the patient's needs, not the nurses. And nursing diagnoses are not medical diagnoses that doctors make, like asthma or ulcerative colitis. Those are different things. Nursing diagnoses are always about patients' needs. We use standardized NANDA terminology to make sure nursing care is consistent and evidence-based. NANDA stands for North American Nursing Diagnosis Association. This is where you pull your diagnosis from. You do not make them up. When you prepare to make your care plan about your patient, that's where you go to find actual or potential nursing diagnosis. Remember, don't make them up. This organization develops and approves all standardized nursing diagnoses. And there's official NANDA book updated every 3 years, and that's the best place to find this complete list of nursing diagnoses. Many textbooks have it as well, and you, of course, can Google it and find it that way as well. Nursing diagnoses fall into 2 main categories: risk diagnosis and actual diagnosis, or risk diagnosis also can be called potential diagnosis and then actual diagnosis. So 2 main categories. Let's talk about risk categories first. Risk diagnosis identify what could happen. So it's not there yet, but it could happen potentially. And when you formulate risk diagnosis or actual diagnosis, any diagnosis, when you formulate your diagnosis, it has to be formulated in a specific way, okay? So for risk diagnosis, we have diagnostic statement and related factor or cause. For example, risk for infection related to immunosuppressive drug regimen. You see the infection is not there yet, but patient is on immunosuppressives, and so we potentially may develop infection. So risk for infection related to immunosuppressive drug regimen. That's risk diagnosis. Now, actual diagnosis describe what is happening right now, what is already there. These require 3 parts, not 2 parts. The 2 parts are the same: diagnostic statement, the related factor, and then we're adding the 3rd factor, evidence that supports it, because now it's an actual diagnosis, we have evidence. For example, knowledge deficit related to misunderstanding of information as evidenced by poor adherence to treatment. By framing the patient's needs in this structured way, and here on this slide it's color-coded for you to help you understand which part is what, we can plan targeted interventions that address both current problems and future risks. The 3rd step in nursing process is planning, and this is where we turn the diagnosis that we created into a clear, actionable roadmap for the patient. Planning involves setting goals that are based directly on nursing diagnosis. That's why planning comes right after we formulated our diagnosis. These goals can be either short-term, such as reducing pain within an hour, or long-term, like improving medication adherence over several weeks. But it always there's always has to be some kind of time frame. We also prioritize diagnosis so that the most urgent needs come first. For example, you're gonna stop the bleed before you treat the headache, right? So prioritizing diagnosis is another important thing we do in this step of nursing process. From there, we formulate desired outcomes, and we choose nursing interventions that will help the patient reach an optimum level of wellness. When writing outcomes, we follow, again, a structured format, like we talked about the specific format that the nursing diagnosis must have. The same here. We need to have structured format. Each outcome should clearly identify the subject. Usually your subject is the patient, sometimes it could be family. The action required is going to be the next part. Then the circumstances, then the expected performance, and finally the time frame. And I color-coded this for you on this slide so you can see what is what on the actual example of the outcome. For example, patient will demonstrate the injection of Lovenox using the preloaded syringe provided, given subcutaneously into the abdomen 1 day before discharge. By making outcomes specific and measurable, we create a clear path for both the nurse and the patient to follow. Other outcomes examples relevant to pharmacology may be patient will verbalize correct insulin administration technique by end of shift. Patient's pain level will decrease from 7 to 3 within 30 minutes after analgesic administration. And there are many other examples that you can formulate yourself for your patients when you work on your care plans. Now we move to the next step of nursing process, the implementation. This is where the plan comes alive and medications are actually administered. Implementation includes several responsibilities: administering medication safely, continuing to assess the patient for changes in condition, monitoring drug effects, both therapeutic and adverse effects must be monitored, carrying out all interventions that were developed in the planning phase, And very important, providing patient education so that they understand their medication, they know what to expect. And finally, we also need to document everything. That is also done in this step of nursing process. We need to document everything clearly and precisely. This also means applying the 5 rights of medication administration: choosing the right patient, the right drug, giving the right dose, through the correct route, and at the right time. And you will see in different texts, many different rights are added to these 5 rights, such as right documentation, right to refuse medications, and many more rights. But these are main 5 rights that you really need to remember and follow every time you administer your medications. But don't stop there. Always consider patient teaching. Don't just hand them the pill. Explain what it's for, the side effects to watch for, and why taking it exactly as prescribed matters. Implementation is where nursing knowledge meets patient safety. And finally, we move to evaluation. This is the last step of nursing process. After administering the medication, the nurse reassesses to answer 3 key questions. Did the medication achieve the desired effect? For example, did the fever drop? Did the pain level improve? Are there any adverse effects that require immediate action? And does the patient understand the importance of follow-up care or lifestyle modifications to support the treatment? Evaluation is the step that closes the loop. It ensures not only that the medication worked, but also that the patient remains safe and informed moving forward. Here's a nursing question to practice. An appropriate outcome for a patient prescribed a new inhaler is: number 1, the nurse will demonstrate how to use the inhaler correctly. Number 2, the patient will correctly perform 2 puffs of albuterol inhaler with a spacer, demonstrating proper technique in front of the nurse by the end of the teaching session. Number 3, the nurse will instruct the patient on the importance of avoiding triggers. Or number 4, the patient will know how to use the inhaler at home. Take a moment to think. Which one is correct here? And the correct option is 2. This outcome is patient-centered, measurable, and very important, it's time-specific. It clearly states what the patient will do, demonstrate the inhaler use, under what condition, with a spacer in front of the nurse, and when, by the end of session. Always think in terms of what the patient will demonstrate, what the patient will say or do, not what the nurse will teach. That's how you know the outcome is measurable and it's a properly developed outcome. Look at number 1. This focuses on nursing action, not patient behavior. The outcome should never be about what the nurse will do. If the outcome starts with the nurse will, it's not a true nursing outcome. That's a little tip for you on exams. That belongs in the intervention section. Let's look at option 3. This describes an intervention, nurse teaching, rather than an outcome, patient demonstrating learning. Planning is about what we want the patient to achieve. Interventions are the steps we take to get them there, so don't confuse the two. Let's look at option number 4. The patient will know. This phrase is too vague and not measurable. How are you going to know that they actually know, right? There's no way to know that they know. You need observable proof. Watch for red flags like patient will understand or patient will know on your exams. Those aren't measurable. Instead, outcomes should be things you can see, hear, or assess. And that's the nursing process in action with pharmacology: assessment, diagnosis, planning, implementation, and evaluation. We call it ADPIE. Remember, this isn't just a checklist, it's a cycle that continues going around and around that ensures every medication we give is safe, effective, and tailored to the patient's needs. From gathering baseline data to setting measurable outcomes, to evaluating the results. Each step protects our patients and strengthens our practice.